Reverend Fathers, invited guests, professors, consultants, my colleagues, friends, and medical students. Very good evening to you all. First of all, I would like to thank the organizing committee for inviting me to give a brief talk about this topic, Dr. Green, the surgeon. I won't take much of your time. I would like to basically touch upon few aspects of Green's contribution with regard to surgery, concentrating on certain facts like, whether he's a surgeon or a physician, a Jaffna, typical Jaffna attitude, isn't it? And the public awareness about his surgical skills, what sort of limitations he had to practice surgery in Jaffna, and what type of surgery he has done, and his contribution as a surgical teacher and as a surgical trainer, and of course the institutions where he has provided surgical services to Jaffna community. As Dr. Dayalan, my teacher, has already pointed out, to answer this question, Dr. Green, is he a physician or a surgeon? It is easy to understand that, by the age of 2021, he was a medical graduate from the College of Physicians and Surgeons of New York. And basically, he was a practicing doctor, and he was an American missionary doctor as well. Now, he came to Jaffna in 1847. Now, the American College of Surgeons was established in 1913. So what I'm trying to say is that surgery as a separate discipline and a college for that particular discipline was established far more later in 1913, not during Dr. Green's era. So a person with medical qualifications, basic qualification to practice as a doctor, was performing surgeries based on the capabilities that he or she has. That was the situation then. But if you look into evidence, Dr. Green has not only practiced as surgeon, he has practiced as physician and also an obstetrician during the period of service here in Jaffna between 1847 to 1873. In the record, we could see more than 1/3 of the cases that he has seen within the first 2 years of service here in Jaffna was surgical cases. Now, I think Dr. Dayalan has pointed out this to you all, how his surgical abilities and skills was brought to the light public in Jaffna. When he came here, the public, the people of Jaffna were treated by native physicians. And it is very, very difficult for them to believe that this man has got the talent of doing surgeries based on Western practice. So one Mr. Muddu Thambi, a Tamil and Sanskrit Pandit, became seriously ill in 1847. And basically he was treated by native physicians. And those native physicians have given up hope on this particular patient. Dr. Green was invited to see him, and he diagnosed this case as an abdominal abscess, probably an intra-abdominal abscess. I think as a surgeon, it could well have been an appendicular abscess, which is not responding to the native treatment. Usually it won't. And basically he made an incision and drainage for the abscess and cured him. The doctor's fame spread throughout the peninsula, and the people of Jaffna looked upon Green as a great healer. This incident, brought up the surgical skills to the light of public. Now you would see the state of art of operation theater of this era, a well-lit area excellent table, anesthetic machine. I think Dr. Ganeshamurthy would appreciate that. The diathermy is available, and all the facilities with air condition and etc. In this type of theater, I have performed laparoscopic Heller's cardiomyotomy in the morning on a 15-year-old child. Now, you all understand the essential elements for a successful surgery are anesthesia, sterility, diathermy, antibiotics, and blood transfusion. Considering the audience here, some of them may not understand the words. That is why I have mentioned anesthesia is given to keep the patient unaware of pain, and the sterility is basically maintains the surgical site free of infection. Diathermy is an electrical equipment which is used to seal the bleeding blood vessels. Antibiotics, as you all understand, would be used to treat established infection. And of course, blood transfusion will be needed if bleeding occurs excessively during the process of surgery. Now, with these facilities, we do surgery in the morning, come in the evening, and give a talk. Now, this is the state-of-the-art operation theater for Green's era. Just a dispensary at Manipai in 1848. So you would anticipate the facilities he had to perform surgeries there in a room like this. Number one, anesthesia. Did he use anesthesia? Nowhere it has been mentioned as to how Green has given anesthesia before doing surgery. But the fact is that the use of ether as an anesthetic agent was first demonstrated by Morton in USA in 1846, before Green came to Jaffna. So Dr. Green was there during that time, and Green came to Jaffna in 1847. So it is likely that he knew about the anesthetic technique that was used by Dr. Morton, and he would have practiced that here in Jaffna, because without proper anesthesia, it is very difficult to do intra-abdominal surgery. And if he has used ether here in Jaffna, no doubt, Dr. Green would have been the first person to use ether in Sri Lanka, then called Ceylon. It was suggested by one of the college's anesthetist presidential address that probably Green would have been the first person to use ether here. Well, moving on to concentrate on the limitations. Apart from anesthesia, the sterile surgery. You know, the Joseph Lister from London, who basically wrote out this concept of sterile surgery in 1860. So half the service period of Green is over by that time. Diathermy was invented by Karl Franz in Germany in 1909, and safe blood transfusion using citrate was identified in Belgium in 1914. And penicillin, as you all know, the basic antibiotic, was found out by Sir Alexander Fleming in London in 1928. So basically, these were not there when he was doing surgery. And more than all, you would all understand the first electric bulb was lit by the help of electricity in Ceylon in 1890, not in a house, but in a hotel, using a diesel generator. So even this facility was not there when he was doing a surgery. Okay? Well, now, if these limitations were there, if I were a surgeon, if I had an opportunity to leave Jaffna, I would have gone away. Now, by this time when he was working, his father was in his 70s and he was not well. And he wanted to see him back to have a chat. And this is basically the reply he has mentioned. I have mentioned that particular part here to show you the determination he had to do service, to do surgery with all the limitations. Basically, the limitations did not limit his determination for surgery. You know, he was writing to his father, not for want of inclination has it been that I have not written you often, how I should like to sit by the side with our feet up in chairs and basket of sweet russets between us, and tell you of all that has happened to me since I shook your hand last time, and hear all that you might say in your humorous, serious way. But it is hardly possible that I shall be permitted the joy of your company again on earth. I am the more anxious, therefore, to talk with you about your soul and to point you again to Jesus Christ, the way heaven, that I may meet you there. For my own part, I am determined by God's good help to reach that blessed place. So this was the letter written by him to his father. Imagine the determination he had to serve our community. This book, as Professor Surendra Kumar mentioned, is available online on Google. The Life and Letters of Green. Basically, this has so many letters wrote by him to his family members. He describes about the culture prevailing in Jaffna. He describes about different disease entities. He describes about types of surgeries he has performed. He described about the problems he faced. Based on this particular book, of course, if you can go through, you would identify that Dr. Green is basically a multifaceted, a person with multifaceted surgical skills. Consider the types of surgeries he has performed. He has practiced like an ophthalmic surgeon or an eye surgeon because he has performed cataract surgeries during that time. Of course, like me, he has practiced as a general surgeon. He has performed strangulated hernia surgeries. He has functioned as a trauma surgeon. He has performed many amputations and of limbs and parts of toes and fingers. He has functioned as an orthopedic surgeon. He has treated fractures. More than all, he has practiced as an oncological surgeon. I would like to stress one fact. In 1850s, this great man has mentioned in his letter that cancer of the mouth is a very common disease entity here in Jaffna, and it is arising from the habitual use of using lime with betel. Now, that particular sentence and that particular effect still stands here in Jaffna. So that is the efficiency of that particular surgeon during that era. He has worked as a plastic surgeon. He has treated burns. Of course, as I mentioned, he has functioned as an obstetrician as well because he has attended some difficult cases of deliveries. Now, if he is working like this, obviously, there will be burnout. What is burnout? It is a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. Imagine one single surgeon doing all sorts of surgeries like this. How did Dr. Green, as a surgeon, have positive impact on mental health to withstand this stress? If you read the book, I would like to quote one sentence here. Overcoming stress by religion and spirituality was the secret. He mentions, I'm dreadfully afraid of falling, but God will keep me safe so long as I hold upon his hand. His aid is my only hope. So this is probably the mechanism by which he was able to withstand the stress of work. He was not only practicing surgery, he has involved himself in teaching and training students. I think Dr. Dayalan has mentioned about Mission Medical School to teach medicine and surgery. Initially, he was teaching the students in English medium, and he took consecutive classes, small classes for 3 years, and the curricula was based on American syllabus. And this photo, everybody knows. But if you read the literature, they would say the first batch of students graduated in 1850. It consists of 7 students, and the names are given there. But if you count the number, only 6 will be there. Okay, so I have mentioned the last one in the letter red. This is Ira Gold. She is a lady doctor. So why doesn't she stand there? Nobody knows. Because of the culture existed during that time, she might have avoided this photo, or some other reason, I honestly don't know. Right? Now, in the second term, from 1864, Dr. Green introduced Tamil as the medium of instruction. And as Dr. Dayalan has mentioned nicely, that he has translated so many books, more than 400 pages. I just taken a photograph. These are all copies of those books, which are available in the library of Jaffna College. Those who are interested, you can visit. They're maintaining nicely. And some of the books are almost dying in the sense that, the pages are that much old. So basically, he has practiced as a surgeon and physician and obstetrician. He has served our country, and he has thought about other aspects, and he has done something to that. That means Dr. Green has functioned as a surgeon with mission and vision by dissemination of medical skills to the community, by meeting the demands of the society, and also having the concept of development of a center for learning. As Dr. Prof. Rajendra mentioned, Green has practiced in the dispensary at Manipai, which has subsequently become, the Green Memorial Hospital, which is existing now. The other institution is the Friend in Need Society Hospital, which was established in 1850s by Sir Auckland Dyke, the first government agent of Northern Province. Everybody knows that Dr. Green was the first visiting surgeon of the hospital. But I would like to add, he has got his student, Dr. Ira Gold, as the first residential surgeon there in that particular hospital. So he had made facilities for that hospital also to function with efficiency. And this hospital is now functioning as Teaching Hospital Jaffna. In 1884, Dr. Benjamin Mills has stated like this: during Green's time, Jaffna was regarded as the headquarters of Western medical science in Southeast Asia. This was the situation then. It is because of dedication, enthusiasm, and zeal of Samuel Fisk Green that the Western medicine and surgery was established in Jaffna. Jaffna community remembers the 200th birth anniversary of medical evangelist of Tamils with great respect. In my book, as Professor Rajendra mentioned, I have summarized all the activities of American medical missionaries and the influence of establishing the Western medical practice to Jaffna. Before concluding, I would like to say that Dr. Green was a surgical giant of his days, and the surgeons of this era are just standing on the shoulders of giants. Thank you very much.